Hola, this is Robin from Herniated Disc Bootcamp. Herniated Disc Bootcamp. And today's question is, what kind of stuff does doctors prescribe if you have a herniated disc? Meaning, if you go and visit a doctor, what will they give you to reduce your herniated disc pain? First off, they will start off, guys, to give you over-the-counter pills, okay? That's the stuff that's not so strong. You know, and it will definitely help you to some extent, you know. Don't use these pills for weeks in and weeks out. You know, if you're gonna go the pill way, give it a go for 2 weeks, okay? And take the pills at the prescribed times, you know, so you're not like mixing it up and doing your own thing. And after 2 weeks, you do an evaluation from that, okay? Next step is you can also get these muscle relaxers, okay? Especially if you've been in pain for a while, your muscles get stiff because your nerve pain is irritating your muscles and all the muscles, the ligaments and everything, so you get tense, okay? So that can help you also. Then they could give you cortisone injections, okay? And this is a bit more powerful, and depending on where they put these injections, that can help you, you know. But again, all of this is temporary stuff that they can reduce the pain for a period of time, so you can start moving. Because start moving, improving your posture, doing your core stability exercises, and changing your habits, that's the stuff that is going to change the stuff or reduce your herniated disc pain long term, okay? So what do they do if none of that helps, okay? Well, then they get into the strong stuff, okay? And this is where you have these different narcotics, like really strong stuff that messes with your head, okay? And I'm not against pills because it's good, because sometimes you just have to get knocked out, okay? Because the pain is so bad. But there is definitely a lot of people that get addicted to this, you know, and the way they get addicted to these stronger substances is, I don't want to point fingers here, but it's a lot of, they're not following the directions on the packages, okay? So what happens to most people that get addicted is this. See if you can recognize yourself. First off, no one wants to get addicted, okay? So most people that are in pain, they're very, very afraid that they're going to get addicted to the painkillers, the strong painkillers. So what they do, they take one or two, they feel better, and then they don't take them for maybe a day or two, and the pain comes back, they get afraid again, and they take one or two, and then they're like off and on with the painkillers, okay? So doing that, you're not going to be able to evaluate the effect of the painkillers, and doing it like that, you're not able to evaluate it, and also people have a tendency to not know really if it's working or not. So my absolute recommendation for you, if you have a chat with your doctor and you guys decide to try painkillers, strong or not so strong painkillers, you know, make a plan for it, okay? I'm gonna take these pills for 10 days, and I'm gonna take them at the prescribed times, and after these 10 days or 14 days, I'm going to evaluate if it has actually reduced my pain, okay? And you have a discussion with your doctor regarding this, because if you have a doctor, back pain doctor, that just prescribes you like 200-300 pills without any form of evaluation or checkup or anything, run, okay? Because that person isn't really serious about what they're doing, okay? You really need to take control yourself over this situation, because drug addiction from taking all these stronger substances are rampant, okay? So please, whenever you're taking pills, make sure that you have a doctor that knows what he or she is prescribing, and also treat you with dignity, respect, and make sure that they actually evaluate the effects of these pills, okay? Or else you can really mess your life up. Okay guys, that's today's tip. And guys, remember, you're just one step away from healing your back pain.